So my name is Joe Kelly and I'm a highly specialised cardiac physiologist. So we provide a variety of investigations which are both non-invasive and invasive, and essentially we're supporting, diagnosing and assisting with the treatment of patients with known cardiac disorders. So obviously our job predominantly is a patient-facing role, so having good interpersonal skills, good communication skills, being a very good listener. They're just some of the things that are definitely essential in being a successful and a good cardiac physiologist. As well as that, as well as working in isolation, we work in multidisciplinary teams as well. So again, leadership skills and communication skills are very important in that environment because we're working with a variety of different healthcare professionals on a daily basis. So this patient's in for a AF ablation procedure. So we're just taking some maps and looking at the electrical signals inside the left side of the heart. So on the screens in the far corner, there's two different views, but that catheter is wafting around the left atrium, which is one of the heart's chambers. And the different colours are showing different amounts of voltage and scarring. And the idea is that this will hopefully improve the patient's symptoms by getting rid of their arrhythmia and put their heart back into a normal rhythm. So there's a few different entry routes into our profession. The main ones are the PTP or Practitioner Training Programme and the STP, which is the Scientist Training Programme. And the PTP is an undergraduate level, which requires A-levels with a science component to them. And the postgraduate is master's level, and again that requires a science component which is relevant to the discipline that you're applying for, and a 2-1 or a first class degree. So as I said before, there's a variety of routes into our job role, but once you become a cardiac physiologist, which is under the healthcare scientist discipline, we all generally have a fundamental level of skills which involve non-invasive work and then usually invasive work as well, but there are obviously opportunities to develop career-wise into different specialisms within cardiology. So imaging is one of those professions, CRM or cardiac rhythm management, which involves patients with devices and defibrillators and pacemakers. And as well as that, further invasive skills such as electrophysiology and helping treat patients who have got electrical rhythm disorders. So as well as the specialisms within our specialism, there are also opportunities to develop further into more clinical roles and more patient-facing roles, which would include advanced practitioners and consultant cardiac physiologist roles as well. So I think one of the best parts of our job role, as I said before, is working in multidisciplinary teams. So we're a big department here and we get to work in lots of different areas. And as well as that, there's different branches to our job role. As I've said, non-invasive and invasive work, which gives you lots of variety on a daily basis. As well as that, as I say, it's patient-facing. So we get lots of good interaction with patients. We build a nice rapport with patients and we get to see them often through from the initial diagnosis and workup to treating those patients and longer term seeing those patients feeling much better, which can be very satisfying, especially if you're involved in that process. So that's the right coronary artery there, and that's the right-sided one. There's only a single vessel on that side. There's a few different side branches, but essentially like a big motorway artery that runs down with small side branches and smaller vessels. Splits off at the end and mostly supplies the right ventricle and inferior wall. And then it splits off into the PLV and the PDA as well. And the second branch of the left system is the circumflex artery that comes around the back and the lateral part of the heart. And for this patient, essentially those arteries are flowing normally. So that looks good. So I think if I had to describe our job role in one word, it'd probably be rewarding. Because as I say, we're involved at different stages in the patient's sort of diagnosis and treatment. We're involved in that. And it can be really rewarding, especially when you've played an important role in that, whether that's diagnosing a particular condition or giving a therapeutic treatment, such as putting stents in for heart attack patients, or putting emergency pacemakers in for patients who are very poorly. The end result is usually a good one and usually really rewarding to be part of that process.